In the late 18th century, smallpox was one of the most feared diseases in Europe, killing millions and leaving survivors scarred or blind. Entire families, communities, and even armies were devastated by outbreaks of this highly contagious disease, and its impact was felt across every layer of society. This was the world Edward Jenner was born into in 1749, in the small town of Berkeley, Gloucestershire, England. A country doctor with a fascination for science and a compassionate desire to help others, Jenner would go on to change the future of medicine with a single controversial experiment. As a young physician, Jenner was aware of smallpox's deadly effects, having seen its destruction firsthand in his patients and community. Yet he also began to notice something intriguing. Among his patients, milkmaids, women who worked with cows and were exposed to cowpox, a mild disease that caused blisters on their hands, seemed to have an unusual resistance to smallpox. The locals even had a saying, "as smooth as a milkmaid's skin," referring to these women's immunity from the pockmarked scars of smallpox. Jenner's interest was piqued. Could it be that exposure to cowpox protected against smallpox? At the time, scientific understanding of disease was primitive. The field of microbiology was in its infancy, and nobody knew that diseases were caused by microscopic organisms. Instead, treatments for smallpox ranged from the ineffective to the brutal, with some people using toxic herbs or undergoing procedures that often did more harm than good. While there was a practice called variolation, which involved deliberately infecting someone with smallpox to stimulate immunity, it was risky and sometimes deadly. What Jenner was proposing was different. He wasn't suggesting using smallpox itself, but rather cowpox, a similar but far milder disease. In 1796, Jenner finally decided to test his theory in a way that would solidify his place in medical history. His subject was an 8-year-old boy named James Phipps, the son of his gardener. It was a bold decision. Jenner knew the stakes of experimenting on a child, but he was driven by the potential to save countless lives. On May 14, 1796, Jenner took pus from a cowpox blister on the hand of a milkmaid named Sarah Nelms, who had recently contracted cowpox while milking a cow. With the young boy's parents' consent, Jenner made a small incision on James Phipps's arm and applied the cowpox matter. Over the next few days, Phipps developed mild symptoms: fever, a slight ache, and small blisters. Jenner watched anxiously but with cautious optimism, knowing this moment could be a pivotal breakthrough. When Phipps recovered from his mild illness, Jenner took the next risky step. He exposed the boy to smallpox. This was a nerve-wracking moment. If Jenner's theory was wrong, James Phipps could fall gravely ill, and Jenner himself could face severe backlash from his community and the medical world. But to Jenner's relief and amazement, Phipps did not contract smallpox. The boy's immunity held, validating Jenner's hypothesis that exposure to cowpox could indeed protect against smallpox. This experiment was groundbreaking. Jenner had not only found a way to prevent one of the deadliest diseases of his time, but had also opened the door to a new field of medicine that would ultimately save millions of lives: vaccination. Jenner continued his research, experimenting on more subjects to confirm his findings. Over time, he shared his work with the medical community and coined the term vaccination, derived from the Latin word vacca, meaning cow. His discovery began spreading through England and beyond, as physicians cautiously tried the new method in their own communities. Yet, Jenner's work was not without controversy. The concept of injecting material from animals into human bodies faced resistance, and some people saw it as unnatural or even blasphemous. Others, skeptical of Jenner's methods, viewed the idea as dangerous and unproven. Religious and moral objections circulated, with some questioning the ethics of experimenting on a child. Still, Jenner's results were undeniable, and over time, vaccination gained acceptance as people witnessed the protection it offered against smallpox. Despite the initial backlash, Jenner's vaccination method began to gain traction. Public health officials and doctors around Europe started adopting it, and it soon spread worldwide. Governments and medical institutions recognized the life-saving potential of vaccination, leading to widespread programs aimed at immunizing populations against smallpox. The method was refined and standardized over time, and vaccination campaigns began saving lives on a global scale. Jenner's discovery sparked a scientific revolution that led to the development of vaccines for other diseases as well. His work paved the way for immunology, the branch of medicine focused on understanding and using the immune system to protect against disease. As more vaccines were developed, diseases like polio, diphtheria, and measles, which had once claimed countless lives, were brought under control. The ultimate triumph of Jenner's work came nearly 2 centuries later. In 1980, the World Health Organization declared smallpox eradicated after a global vaccination campaign, the first and only infectious disease to be completely eliminated. Jenner's method had not only prevented countless deaths, but had also eliminated a deadly virus from the human population. This victory underscored the power of vaccination, a concept that started with a simple observation of milkmaids and cowpox. Today, Edward Jenner is remembered as the father of immunology. His pioneering work in the face of skepticism and resistance transformed medicine and showed the world a new way to fight disease. The principles Jenner uncovered continue to guide vaccine research, providing a foundation for the vaccines that protect us against diseases such as influenza, hepatitis, and COVID-19. This retelling of Edward Jenner's discovery highlights how one observation led to an achievement that shaped modern medicine, forever changing the way we prevent and manage infectious diseases.